Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Today, we'll be talking about how to lower your risk of dementia with Dr. Sharon Brangman. She's the chief of geriatrics at Upstate, a SUNY Distinguished Service Professor, and former president of the American Geriatrics Society. Welcome back to the Informed Patient, Dr. Brangman.
Thanks for having me again.
We'll be talking about potentially modifiable risk factors, but I want listeners to realize this applies to large population groups, not individuals. So there may be a study showing that one factor is associated with a particular outcome, but that doesn't mean an individual person will have that same outcome. And also, Dr. Brangman, we're not sure what causes Alzheimer's, right? Is that the current thinking?
Yeah, it's a very complex disease, and it's not likely to be caused by one thing. More likely than not, it's going to be a combination of different factors, and each individual may have a different presentation or a different set of risks. So right now, the focus is on amyloid buildup and tau buildup, which are abnormal proteins in the brain. So there are drugs that are specifically targeted at removing the amyloid and the tau, but we all know that's not the full picture. There are other factors that come into play, and there's a lot of research that hopefully in the coming years, we're going to learn more. And it may be one of those cases where we get an individualized profile of what our risk factors are, and then we can address those personally. So what you said initially about people taking this and thinking that it's 100% for them is not necessarily true. We're looking at general trends in the population.
So regarding risk factors that we may be able to change, what effect does diet have on Alzheimer's risk?
So diet is very important. And there's a lot of data that shows that people who eat a diet that's good for their heart is also good for their brain. The Mediterranean diet has been suggested as one of those diets that emphasizes lots of fruits and vegetables, lean protein like fish and chicken. It de-emphasizes red meat like beef. It does include wine, and wine is a bit controversial because wine is such a critical factor in our society, but there's really no safe amount of alcohol for us to take. And we do know that alcohol can damage nerve cells. So I think people have to balance it. And then again, people say, well, it's a quality of life issue. And that's true. You have to decide what makes sense for you. I'm not necessarily like the food police, but I can tell you that we know that large amounts of alcohol actually shrink the brain. And anytime you shrink the brain, you're losing brain cells. And we also know alcohol can raise blood pressure, and high blood pressure isn't good for our brains or our hearts or our kidneys. So a healthy diet that's good for your heart, the food that isn't prepackaged and convenient. We live in a society where everybody is so busy and we want something quick. Well, if the food had to make a stop at a factory before it hit your plate, it's probably not the best for you. That's not to say you should never eat it, but it should be a rare occasion that you eat fast food, prepackaged food, food that you just nuke in the microwave, because they often have a lot of preservatives, salt, fat, sugar levels that are not healthy for your brain.
Let me ask you a little bit more about going back to the wine. Red wine in particular, I thought that the healthy part of it was said to be the resveratrol from the grapes, I think.
A lot of those studies were funded by the alcohol industry. So there's a bit of a conflict of interest. And it's not necessarily good for our heart or our brain like first proposed.
I see. Now, when we talk about heart healthy, generally we're looking for lower sodium, lower sugar, or no sugar. Why are sodium and sugar not good for your brain?
As Americans, we get so much sodium which increases blood pressure. And high blood pressure causes a lot of wear and tear on the nerve cells in the brain. It also does the same thing to the heart and the kidneys. And high sugar also, over the years, makes your body less sensitive to the effects of insulin. So you get what's called insulin resistance. And that's what leads to diabetes. And so many of the patients that I take care of, when we are making a diagnosis of something like Alzheimer's disease, they have hypertension, diabetes, and high cholesterol. So those three things cause a lot of wear and tear on our nerve cells and on our blood vessels. And that is not good for the brain.
So fruits and vegetables are good, and lean proteins, you mentioned fish and chicken. Does dairy have a place in a healthy diet if you're thinking of brain health?
Dairy has a place. It's a good source of calcium and protein. And a lot of older adults start to have trouble digesting cow's milk because it's really made for a baby cow and not for humans. I have patients who can't really tolerate it. It's not like they will then be unhealthy if they eliminate it from their diet, but it is a quick and easy way in our culture to get some extra protein and some calcium and other minerals. But you can make that up in a non-dairy way as well.
And let me ask you before we move on from this topic about fiber. Is that something that's important?
So fiber is important because it helps to slow down the absorption of sugar and other things, and it helps to remove some of the cholesterol and the fat, and it keeps bowels regulated, which is also healthy. So yes, fiber is good for us, and that's usually in whole grains. So if you're looking for products, they shouldn't be processed to the point where the nutrients are being taken out of the wheat. And so that would be things that are like white flour. You would want to have whole grains, things with nuts and seeds in it, because those have important vitamins and minerals and also increases your fiber.
So reading food labels on those crackers and bread products.
Very much reading food labels, which can get a little tricky as our eyes get older, but very important.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking about reducing the risk of dementia with Upstate's Chief of Geriatrics, Dr. Sharon Brangman. What role does exercise play in dementia risk?
Exercise is probably one of the most important things that we can do to reduce our risk of dementia and cognitive decline. Because every time you exercise, your body makes these special products that help nerve cells grow and stabilize. And they're circulating in our body, but when you exercise, they move into the central nervous system where the brain is. It also lowers blood pressure. It also helps you handle sugar and fats better. And it keeps your heart healthy. It helps with circulation. So there's really no downside to exercising. And people think that they have to run a marathon or do something really extraordinary. And it's really about 150 minutes a week of some sort of aerobic activity like walking. And if you throw in some weight work so that you increase muscle mass and muscle strength, that's another benefit, because as we get older, our muscles tend to get smaller and shrink. And you want to keep them strong. And you also want to reduce your risk of falling, because if you fall and hit your head and get head trauma, that's not good for your brain or your brain health. So exercising is important. You can take a walk. If you don't have a safe neighborhood to walk in, you can walk in a big store or in a mall. And if you walk with a friend, that's an added bonus, because another factor for reducing our risk for dementia is increased social engagement. So many people, as they get older, tend to get more isolated and talk to fewer people. And we learned during the pandemic, when people were really locked up in their homes and not interacting, there was actually an increase in dementia. So take a walk with a friend or someone and talk, socialize, and you're getting an extra bonus.
And this is something we have to do as we age. I'm wondering if we were active as kids, do we accrue these benefits and we draw on them as we're older, or we have to keep doing it?
You have to keep doing it, and it's really not too late to start. You have to think of it as brushing your teeth or combing your hair, if you have hair. But it's something you have to do every day because our bodies were made to move. It's not like you put it in the bank from when you were a kid. You have to generate that bank every day.
How does smoking impact dementia risk?
You know, when you ask a doctor, we're never going to say smoking is good in any way. But smoking damages the lining of our blood vessels, which then damages the integrity or the strength of the blood vessels, and it can impair blood flow. So we know that people who smoke not only have an increased risk of heart disease and lung cancer, but they have an increased risk of dementia as well. So smoking is not good in any way, shape, or form.
What about vaping? Does that fall into the same category?
Same category.
Well, we talked about the benefits of exercising with someone so that you're interacting socially. Kind of tied to that, is there a belief that mental stimulation, crossword puzzles, those sorts of things have any sort of protective effect?
No, there really hasn't been shown a protective effect with Sudoku or crossword puzzles. And everybody thinks that that's the way of making sure that you keep your brain sharp. If you enjoy doing it, there's no harm in doing it. But if you find it frustrating and stressful, then don't bother. It's more important to have a social engagement with someone. Read a book and go talk about it, listen to music with someone, do something that engages your brain with another person.
Does sleep quality have a role in dementia risk?
So sleep is very, very important because when we go into the deep sleep, that's when our brain cleans up all the toxic chemicals from the reactions they have during the day. The challenge is as we get older, it's harder to get into that deep sleep. It's a natural part of our aging process. So we've all heard the term you sleep like a baby, where a baby could sleep in the middle of a really loud, crowded room. But as we get older, that gets harder and harder. And then with the introduction of screens and something to always keep your eyes and your brain active, that can also be harder to go to sleep at night. So yes, you have to work on getting a good night's sleep. And then just as another additive here, there is really no safe sleeping pill. You'll see a lot of advertisements on TV, and they often include ingredients that aren't good for our brain, especially as we age.
So run those by your physician before you start taking them?
Yeah, just because you buy it over the counter without a prescription doesn't mean it's safe.
Let me ask you about a person who has a history of head trauma from when they were younger. Does that increase their risk of dementia?
So yes, it could. And again, it's a very individual thing, and it depends on what the head trauma was and how many episodes they had. So we've all heard about football players who have multiple concussions and how they develop a certain kind of dementia over time, over decades. So yeah, the brain doesn't forget when it's had a serious trauma, and it may start a kind of cascade process within the cells in our brain that doesn't become evident for decades later.
I assume there's nothing that can be done preemptively.
No, but you should wear a helmet if you're going to ride a bike. It should be a well-fitting helmet. I would think very carefully about signing that permission slip for your kids to play football, but also consider that for soccer and other sports where you might be butting your head, because the brain will remember. And I always tell people, hire someone to clean your gutters. Do not get on a ladder. Your brain will not do well if you fall off of a ladder.
So minimizing fall risk as best you can.
Reducing fall risk. It may look easy to get that item on a top shelf on a little step stool, but you'd be surprised how many people fall and it changes their lives.
Is it true that people with uncorrected vision loss and people with uncorrected hearing loss are both at increased risk for dementia?
So yes, we have found that if you're not getting the right information into your brain, either through your eyes or your ears, that does increase your risk of dementia. It increases your social isolation, but those are all important nerves that go directly into the brain. The optic nerve and the auditory nerve go directly into the brain. And when they're not functioning well, then the brain isn't functioning well. So we should get our vision checked and corrected. And a lot of people don't like to wear hearing aids, but it's very important to figure out if you have hearing loss, how to get it corrected. And now it isn't quite as expensive because they have made hearing aids available in places where they should be more affordable. And then this is something that younger and middle-aged people should think about, is avoiding high decibel or highly loud environments that could damage your hearing. So all of the baby boomers who went to those rock concerts, or even loud big stadiums, lawnmowers, things like that can cause hearing damage, which over time can increase your risk for dementia.
So wearing glasses or using hearing aids, that can decrease your risk?
So yes, because if you're able to hear and see the world around you, that keeps the nerve cells functioning in your brain.
Now, is hearing loss ever a symptom of dementia?
Not per se. It's usually not one thing.
What can you tell us about flu vaccine and its effect on the risk of Alzheimer's?
So, in general, it looks like vaccines are a significant factor in reducing your risk for dementia. In some studies, they estimate it can reduce your risk by 20 to 40%. And the reason why is a point of a lot of research. But these viruses, whether it's the flu or even the herpes virus, which causes shingles, or the respiratory syncytial virus, which is RSV, all of these viruses cause an inflammatory response in our body, and especially in our brains. And we know that inflammation damages the nerves in our brains and in other parts of our body. There have been some instances where they've actually found the herpes virus in people's brains. So they might have had a herpes infection and the virus settled into their brain and probably triggered the cascade that led to dementia. So anyone who gets a vaccine can reduce their risk of getting that infection, or even if they got the infection, it would not be as severe. So there would be less inflammation and potentially less nerve damage. And that's across the board. So there were some people who thought people who get vaccines are probably healthier. They're more likely to be aware of their diet and maybe they're exercising, and they see vaccines as another component of taking good care of their health. So they looked at that and separated that factor. And even if you remove those people who had a healthy lifestyle, they found that the vaccines still help to reduce your risk of dementia and cognitive impairment.
This is relatively new information, though, right?
So yes, as I mentioned earlier, there's been lots of research going on for different pathways that might start that cascade for dementia. So we know that the endpoint may be the buildup of those abnormal proteins that I mentioned earlier, amyloid and tau. But what triggers those proteins to form? So those proteins may start to form because of neuroinflammation, or high blood sugars, or hypertension, or head trauma, or so many other things. So we see the endpoint. What we're trying to figure out are what are the factors that might cause those proteins to form in the first place.
So the anti-inflammatory medicines like ibuprofen or aspirin, do they reduce risk too?
Not across the board. There's been a lot of studies looking at those, and the research did not endorse those as definitive ways of reducing your dementia risk.
What about cholesterol and blood pressure medicines?
So, yes, if you lower your cholesterol and you lower your blood pressure, that helps to keep your blood vessels healthier and your nerve cells healthier and reduce your risk of dementia.
But for someone who doesn't have a cholesterol problem or a high blood pressure problem, those are not being used to reduce
No,
risk.
no, it should not help you if you don't have the problem in the first place.
We talked a little about diabetes, but what is the relationship between diabetes and dementia?
So the nerve cells in our brain are very sensitive to sugar. And when you have diabetes, your body has a hard time breaking down sugar. You have more insulin resistance. And when that happens in the brain, then those nerve cells are not getting the sugar they need to function. And that may trigger the development of abnormal proteins or other things that can increase your risk of dementia. Nerve cells die, they don't function normally. And it's usually with something that happens over years. It's usually in people who have had long-term diabetes without good control.
You're listening to Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking about reducing the risk of dementia with Upstate's Chief of Geriatrics, Dr. Sharon Brangman. Have you seen any evidence that the GLP-1 medications, now these started out for diabetes only, but a lot of people are taking them for weight loss now, are they having any effect on a person's risk of dementia?
So that's been a very interesting discussion. The thing is, these are relatively new medications, and dementia has a much longer trajectory. So I think there are studies going on right now to see if over time they may help to reduce your risk of dementia. So if you are taking these meds and your diabetes risks go down and your hypertension gets improved, and if your cholesterol goes down, you could argue that helps to create a healthier person. But whether these drugs in and of themselves reduce your risk of dementia, I think is a little too early to say.
Is obesity a risk factor itself for dementia?
Well, it's usually because obesity is associated with other diseases. So if you have obesity with hypertension and hypercholesterolemia or abnormal blood sugars, then yes, it goes with that package. But there are some people who are obese who are physically fit and have normal blood pressures and blood sugars and cholesterol. So I don't think obesity per se. What happens over time is a lot of times the body starts to have problems. You might be able to get away with things when you were younger that you just can't as your body ages. So that's, again, something for people to discuss with their doctor.
So are there other factors being looked at as potentially having protective effects?
So, yeah, there are other chemicals in the brain that may, if they're supported or increased, may be helpful, but it's all very preliminary. What we have to hope is that there's continued funding for this kind of research, because these are the components of how we solve medical problems. And these are usually research studies that take years and years and a lot of investment to get an answer from.
So you've emphasized that this is very individualized. It sounds like not everyone has the same risk factors for dementia. Are there certain people who are at higher risk, and would they know who they are?
Again, we're learning more about this, but there are people with genetic risks because it runs in their family. So they were born with certain genes. That's not the overwhelming majority of people, though. but there are certain families with the genes that will increase their risk of getting dementia. But for other people, it's not that clear. It may be related to wear and tear on your brain over many, many years because of lifestyle and diet and other choices.
What are the symptoms and signs for a person to sort of be on the lookout for that would clue them in that maybe they are at higher risk or maybe they've got some of the early signs and symptoms?
Well, the earliest signs are usually pretty subtle, and people usually attribute them to other problems like being tired or stressed or something. But it's just starting to have problems keeping information straight, keeping information organized, and maybe getting through the day without a lot of stresses and bumps and turns and twists. So you might have somebody who repeats conversations, can't remember new information, but they can remember things from the old days very clearly. They just are not their usual self. You might have somebody who used to be very organized and now they're having more trouble keeping maybe their house organized or their car. Maybe they get a little bit confused when they're driving. I had a patient who couldn't handle the detours and the road construction and got totally turned around, and a trip that would have normally taken her 10 minutes took way over an hour. She couldn't problem solve out of the situation. So if you see someone start to have trouble figuring out things or solving problems that they normally would have done very easily, that would be something else to consider or be concerned about. Other subtle things are maybe somebody who used to be a very meticulous dresser, now their clothes are stained, or maybe they're not appropriate for the weather. Maybe they come out in the winter with summer clothes, or they have turtleneck and a sweatsuit on in the summer. Just little things that can be subtle and can be off. And what we should know is that it's not normal to be forgetful or to have memory problems as we get older. So we can have what's called slow retrieval, which means it can take you a little longer to get that name out or that word out. It's at the tip of your tongue and you can't get it, but you can usually retrieve it in a reasonable amount of time. Or you could misplace something, your cell phone, your glasses, but you can usually retrace your steps and find it. But if you have trouble retrieving that word, if it doesn't come to you for several hours or days, or if it's the wrong word, or if you can't retrace your steps and remember where you might have left something, or when you find it, it's in a really weird place, then I would start to be concerned. So there are normal changes in how our brain functions as we get older, but it's not normal to have a memory problem. So I still have patients who come to me and they say, "Oh, what should I expect at my age?" Everybody tells me, "Oh, I forget things too." Well, everybody forgets things, but there is a difference. And if you have any concern, it's better to get it checked out. Sometimes it could be due to medications, medication reactions, other things that you are doing that can be very easily adjusted. Or sometimes it is a memory problem that needs to be looked into further. But you really need to come in and get it checked out so that you can know which way to go. There's lots of options now that we can discuss to help. And even if we can't cure it, we can always take care of you and help you maintain the highest quality of life for as long as you can.
One other thing I was going to ask you about is diagnosis. Are you using saliva or blood tests for the diagnosis?
The New York State Department of Health was the last health department in the United States to approve the blood test. However, it's expensive. Insurance companies aren't necessarily paying for it. And so it's not that easy to just say, "Oh, I'll get a blood test." And we don't recommend people just get it to see because that can cause a lot of stress. It doesn't necessarily mean you have it just because you have the blood test.
Well, this has been very informative. I really appreciate you taking time to tell us about this, Dr. Brangman.
Thank you again. I'm always happy to chat with you.
My guest has been Dr. Sharon Brangman, the Chief of Geriatrics at Upstate, a SUNY Distinguished Service Professor, and the former president of the American Geriatrics Society. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.